Can ultrasounds truly harm your unborn child? Is having frequent scans a dangerous practice? And can doctors actually reveal your baby's gender through these images? Today, we are going to confront and dismantle those persistent myths that have taken root in people's minds for generations, often fueled by well-meaning but misinformed advice. Meet Anjali, a 28-year-old woman, glowing with the anticipation of motherhood. She is filled with excitement, yet beneath that joy, a quiet confusion brews. Every time she prepares for a sonography appointment, she is bombarded with a fresh wave of conflicting advice and old wives' tales from well-meaning relatives and neighbors. The whispers follow her, planting seeds of doubt. She turns to her husband, her brow furrowed with worry. Everyone keeps saying too many ultrasounds will make the baby weak. Is that really true? All Anjali truly desires is a healthy baby and the unvarnished truth, free from the shadow of fear. Her only flaw, perhaps, is her tendency to absorb these external voices without truly questioning them, allowing them to chip away at her peace of mind. Anjali's journey is not hers alone. It is a tapestry woven with the voices of those around her. Her mother-in-law, steeped in tradition, often remarks, "In our time, we only had one scan. There was no need for all these frequent checks." A friend, armed with snippets of information gleaned from social media, adds to the anxiety. "I heard the rays from the machine can cause problems for the baby, you know? They say it heats up the womb." Each comment, each piece of unsolicited advice represents a societal echo that amplifies Anjali's fears, making her question the very medical guidance she is receiving. Yet amidst this chorus of doubt, there is another voice, calm, professional, and grounded in truth. Her doctor, a steadfast guide through the labyrinth of misinformation. The weight of these myths begins to take its toll. Anjali, consumed by worry, starts to avoid her scheduled scans. She even skips one crucial sonography appointment, a decision born of fear, not reason. This is a common trap many expectant parents fall into, believing that by avoiding the procedure, they are protecting their child. But the reality is quite the opposite. Her doctor, noticing her absence and the growing apprehension, gently but firmly confronts her. "Anjali," the doctor explains, her voice reassuring, "ultrasound is not an X-ray. It does not use any harmful radiation. These are simply safe sound waves, much like the everyday sounds you hear. If you allow these myths to dictate your decisions and postpone your scans, it becomes incredibly difficult for us to monitor your baby's vital growth and overall health." The doctor then offers a simple, powerful analogy. Think of an ultrasound like using a flashlight in a dark room. It does not change the room itself. It simply allows us to see what is already there, to understand and ensure everything is as it should be. This analogy is crucial because it highlights the passive, non-invasive nature of the technology. Ultrasound technology uses high-frequency sound waves that bounce off internal structures, creating echoes that a computer then translates into real-time images. There is no ionizing radiation involved, unlike X-rays, which can indeed be harmful in high doses. The energy levels used in diagnostic ultrasound are extremely low and have been rigorously studied for decades, with no credible evidence linking them to adverse effects on fetal development. One of the most common misconceptions revolves around the frequency of scans. Many believe that fewer scans are inherently safer. However, the number of ultrasounds recommended by your doctor is based on medical necessity and established guidelines. Early scans, often performed in the first trimester, are vital for confirming pregnancy, determining gestational age, checking for multiple pregnancies, and identifying potential ectopic pregnancies. Later scans, typically around the 20-week mark, are crucial for a detailed anatomical survey, allowing doctors to assess the baby's organs, limbs, and overall development, and to detect any structural anomalies. Additional scans may be recommended for various reasons, such as monitoring fetal growth, checking placental position, assessing amniotic fluid levels, or investigating specific concerns that arise during the pregnancy. Each scan serves a specific diagnostic purpose, contributing to a comprehensive understanding of the baby's health and allowing for timely interventions if needed. And what about the myth of gender revelation? Can doctors truly reveal your baby's gender through these images? Yes, they can, but it is not the primary purpose of the scan, nor is it always guaranteed. The ability to determine gender depends on several factors, including the baby's position, the gestational age, and the clarity of the image. While many parents eagerly anticipate this reveal, the medical focus remains on the baby's health and development. There are no rays or settings that specifically target gender determination in a harmful way. It is simply an observation of anatomical features when they are visible. The choice before Anjali is stark, the stakes incredibly high. If she continues to believe these unfounded myths, she risks her baby's well-being, potentially missing crucial developmental insights. For instance, an undetected growth restriction could lead to complications at birth, or a missed placental issue could endanger both mother and child. These are not minor risks. They are serious concerns that sonography is designed to mitigate. But if she chooses to place her trust in her doctor, in science, she gains not only peace of mind, but also the assurance that every precaution is being taken for her child. Therefore, Anjali must make a pivotal decision to choose truth over the paralyzing grip of fear. As if to underscore this truth, the doctor then guides Anjali's gaze to the monitor, where a real-time scan unfolds. On the screen, a tiny form stirs, a foot kicks playfully, and a strong, steady heartbeat pulses rhythmically. The doctor smiles warmly. See, your baby is happy, perfectly normal. These myths, Anjali, they only serve to create unnecessary fear and can sometimes lead to dangerous decisions. In that moment, watching her baby's vibrant life unfold on the screen, a profound understanding washes over Anjali. The fear that had clouded her mind for weeks begins to dissipate, replaced by a surge of clarity and conviction. She feels a newfound strength, a protective instinct that empowers her to speak her truth. Later, surrounded by the very relatives who had fueled her anxieties, Anjali stands tall. Her voice, once hesitant, now rings with quiet authority. "Ultrasound," she declares, looking directly at her mother-in-law and the others. "It protects the baby, it does not harm. It helps the doctors make sure everything is okay. From now on, I will have every scan without fear." A wave of emotional relief washes over her, visible in the softening expressions of her family, even her mother-in-law's stern features yielding to a gentle nod of understanding. The truth, finally, has set her free. Anjali's journey is a powerful reminder for us all. Sonography is not a collection of myths or superstitions. It is a vital branch of science. It exists as a tool, a window into life, designed for the safety and well-being of both you and your precious baby. It empowers medical professionals to monitor development, identify potential concerns early, and ensure the healthiest possible outcome. The message is clear and unwavering. Armed with the right information, we can make the right decisions, free from fear and doubt. If you, like Anjali, find yourself grappling with fears or uncertainties fueled by myths surrounding sonography, do not let misinformation guide your choices. Seek out the truth today. At Vintage Diagnostic Centre, we are dedicated to providing the safest, most advanced, and compassionate sonography services. Our team of experienced professionals is here to answer your questions, alleviate your concerns, and ensure you receive the highest standard of care. Your trust in us is not just a transaction, it is our profound responsibility. We are here to offer clarity, care, and the peace of mind you deserve during this incredible journey.